Welcome to the Mind Vine podcast, where we challenge the stigma associated with mental illness through conversations about a variety of issues impacting mental health. Here we bring you news, views, and interviews that intrigue, educate, and celebrate recovery.
Welcome to the Mind Vine podcast. My name is Darryl Mathers, and today I have with me somebody from Ontario Shores that's going to help us talk about all things recovery, including a unique partnership with a national organization. But first, I want to bring in research scientist, even though she has three different profiles in the organization with three different titles. I'm told she's a research scientist. Dr. Simone Arbour, welcome.
Thanks.
How are you doing today?
I'm doing well, thank you. How are you?
I'm good. You were worried about children running through your screen, but that doesn't seem to be an issue at the moment.
Not yet, anyway.
No. Before we get into our topic today, which is recovery, maybe talk a bit about recovery in your work. Like, why did you get into recovery? What does it mean to be a research scientist kind of in the recovery field?
So I think why someone like me has a job is understanding this organic phenomenon that is recovery. It's this notion that individuals with mental health challenges, have great options when it comes to clinical care and treatments and those kinds of things. However, although we've come a long way in mental health treatment, there's no cure. There's no cure. So what if you are told you have treatment resistant, whatever, right? Is that it for you? So recovery is this notion that no, that's not it for you. And you are not defined by your illness. You have purpose and possibility, even though you may have challenges. So my job as a researcher is to look at what factors, what experiences, what can enhance an individual's sense of purpose, of passion, meaning, connection, even though I may have challenges. So my job is very applied in nature, and we'll talk about it today, is what sorts of programming, interventions, whatever you want to call them, can we develop, implement, and evaluate to enhance that sense of personal recovery.
Recovery is something we hear a lot at Ontario Shores, other mental health organizations as well. Recovery College is what we're going to talk about today. And before we bring in our guest, as it relates to Ontario Shores, what is a Recovery College at Ontario Shores? What does that mean? And what is some of the work you do related to that?
So Recovery College, if you want to access college, in your mind, that's sort of what it is. But all the courses in this Recovery College are elective, and they're not diagnostically driven, and they are all strength-based. So it's not you fixing something that's broken. It's you amplifying strengths that you already have and sharing those strengths and those experiences. So why, in Ontario Shores world, why this was such an interesting and powerful undertaking was a lot of times our service users, in a tertiary mental health hospital, feel like mental patients a lot of the time. And that identity, just historically, is one that is fraught with stigma, right? Misconceptions about you, that you might be dangerous or you're different or you're, So a student identity or an artist identity or a musician identity, and that's the identities we cultivate in the college, are much more, beneficial to that person, and that's who they are. They're not a diagnosis. They're a person with many different facets. So Recovery College, in our context, was really different because, treatment, as you know, in general is referral based, and a professional tells you what you need. Recovery College is not like that. There are no referrals. It is all about self-determination. A person decides what they want to take, what they want to learn, and also what they want to teach, because they have the opportunity to teach in the college as well. So in our neck of the woods, it was a real transformation of culture because it was looking at positive risk taking. It was looking at and you know, hospitals are very risk averse. So it was doing things differently and recognizing an individual seeking mental health services is not a diagnosis. They're a person with strengths and passion, and the Recovery College amplifies that. So it is peer-based, and it's co-produced, and it's very empowering for an individual who's been a passive recipient of care to really sort of determine their path to wellness and take control.
So that brings us, kind of to the larger discussion of Recovery College. And we'll bring in Erica McDiarmid. She's the National Program Manager for Recovery Colleges at CMHA National. Welcome, Erica.
Hi, thanks for having me.
Yeah, no problem. It's fun to have you on. And this is a topic that I've, like I mentioned before, is quite common at Ontario Shores. Recovery College, I remember when I first heard it, I was like, well, what is that, right? When you blend the kind of identity of school and recovery from mental illness. So Simone kind of just gave us a synopsis of what it is at Ontario Shores, and I know that there's a bigger conversation to be had. So when it comes to this partnership that Ontario Shores and CMHA National, this undertaking for Recovery College expansion, tell us what that what it means in terms of Recovery College and CMHA National now that Ontario Shores has been involved.
Yeah, so the partnership has been a couple years together already, and I think it's really been about connecting with Ontario Shores from CMHA's side, who had been in this recovery space for quite a while, and there had been a couple of recovery colleges already established in CMHAs across Canada. And so it was looking at, we're both in this space, we're both trying to implement this model that's coming from the UK in a Canadian context, and so let's work together to really understand and explore what that actually can look like in Canada. Because often when you're pulling in models from other jurisdictions, other countries that have different systems, that have different funding models, it doesn't always translate in the way that you might think. And so part of our partnership has really given us the opportunity to start exploring what this actually looks like within a Canadian context, and learning from each other in our different settings, so whether it's hospital-based, community-based, and post-secondary based, and really understanding how we can take this model that's evidence-based and has shown really, really incredible outcomes in UK and other countries. What does that really look like here? And so we're able to sort of utilize some of the expertise at Ontario Shores, like Simone, in supporting implementation of our recovery colleges as we try and spread and scale across all CMHAs across the country, but also being able to tap into some of the evaluation and research to help us really understand what it is we are implementing, how best we can implement, how best we can support our local branches in offering this type of programming. So it's really been able to be a collective learning, I think, for both of our organizations to best support the local branches who are interested in being able to serve more people and meet a need in the community where there hasn't always been this type of programming available.
What was the reaction like as you were rolling this out across the country into different settings? Like, was there a lot of education that needed to be done, or was there a lot of excitement, or a combination of both?
At the outset, there was a lot of education. So, but in general, right? I've given, what is a recovery college presentations more times than I could probably count, because as Erica said, it's new here. It's a new way of thinking. So as we met, executive directors from branches, and we met from PEI to Yukon and everything in between. You could see they had components. They had components that could be used in this. But once they saw the vision and some of the preliminary outcomes that I had, and some of the theory, like once we took the research and what was known and tried to convey that to the different branches, it wasn't a hard sell. right? It was very, wow. And then it was, what's the catch? You know, do you remember? Like, it was, no, we want to transform the mental health care landscape. There is no catch. We will support you, help you lay the foundation, and as much, little or as much support as you need, because some branches had a lot of the infrastructure already in place. Some were starting from scratch. So we would work wherever the branches were to help cultivate something like this. And so our vision, you know, we thought, let's do 20 recovery colleges in 2020, and we were able to do that because it's, yeah, like I said, it's not a hard sell, and a lot of the community agencies already had a huge peer base that they could draw upon, and then also kudos to CMHA Winnipeg, because they also wanted to start a community of practice. So we would all come together as a community of practice, and Erica was at the helm there to see how can we take the lessons learned at all of these different branches and, not reinvent the wheel. We shared resources, we shared training, and we also shared an evaluation vision. So I think the reaction was one of excitement, really. And Erica, you can speak to the community of practice, but how many people do we have now at the community of practice? Like,
we have about 150 people on our distribution list for a community of practice, and ranging from all different kinds of organizations, not just CMHAs, and from executive directors to peer educators, to students who have participated in recovery colleges. So the community of practice really has grown over the last year to be really inclusive and try and get as many perspectives as we can around the table when we're talking about the future directions of recovery colleges, or helping new recovery colleges in giving them some lessons learned and some ideas of how to overcome challenges or limitations in their particular delivery, whether it's a rural, remote community or a urban center trying to reach a large number of people. So the community of practice has really, I think, been beneficial for the collective because it has this opportunity for people to come together with sort of a shared vision, shared energy in terms of really pushing recovery colleges forward. And there's been a lot of great collaboration and partnerships that have actually come out of the community of practice as well, which is part of the sort of the sentiment of recovery college is really that collaborative approach. And so we really try to promote that and integrate that into all of the elements of the work that we're doing within the scope of recovery college.
And to give you a sense, in 2016, when Ontario Shores launched our recovery college, there was maybe one, like at St. Mike's, that I could go to, like a recovery college. Other than there was none. So to go from like hardly any to, I don't know how many we have now. We have 30 almost, or approaching 30, right? So it is just evolving and growing in a short period, as it has in other places too. So I think this partnership is really laying a foundation to really see that transformation.
The partnership piece as well. You're working together, different organizations, slightly different mandates, filling a need in the mental health system. It sounds like the future. It sounds like what governments want, organizations like ours to be doing. What's it been like learning from each other? Like learning. I'm sure, Simone, you have really had to dig down and learn a lot about CMHA National and maybe the same on your side, Erica, but what's that process been like personally, like learning throughout this journey?
I think I've learned the passion of community-based organizations. Like I remember meeting with the director at UConn, who was also working the front desk that day. Do you know what I mean? Like she's so, and all of the branches that I met with, they're so passionate about advocacy and doing mental health well, and actually, a lot of times when if I do lectures at universities, or I really have to talk about recovery, like from a historical perspective, and I have to do a lot of theory. I don't have to do a lot of education in community-based settings. They live and breathe strength-based recovery, right? And I've just learned what is possible. So even from a peer support model, I've seen some amazing peer support. I've seen family peer support. I've seen and you just get so many ideas. So I think because community-facing organizations are dynamic and they react quickly, they can really evolve to meet the needs. And so I just see what's possible, so I've learned a lot in that regard.
Yeah, I think for me it's been a little bit different too, because I came into this project in the middle of it. And while I did understand Recovery College in sort of the theoretical perspective, I've learned a lot through working with Simone and working with her team and their Recovery College about the processes that need to be in place to really be able to implement the model with fidelity and what actually goes into that. And so that's been really eye-opening for me to see, Ontario Shores kind of is like a well-oiled machine a little bit in how they develop courses, how they deliver courses, and make it look quite easy, although I know that it isn't, but being able to sort of learn from them in terms of some of those processes that are really necessary to follow sort of the principles of Recovery College, and be able to create programming that is representative of the people who are showing up for it and filling in those gaps. So with working with Ontario Shores, for me personally, that's been a really great opportunity to sort of see the first phases of that and what that could look like.
Yeah, moving away from like the partnership piece, now that we're offering these services, in almost 30 places across the country, we have our own here at Ontario Shores. How can I access a Recovery College course? Like, what does it look like, whether it's here at Ontario Shores or CMHA branches? If I'm somebody struggling, how do I get involved? What do I have to do?
Well, it's interesting because COVID has really forced us to operate differently. So we're doing a lot of, most I think are virtual. If not all, like moving back into the physical space. But so that actually, it was a blessing and a curse, right? Like the COVID obviously created, like the need for recovery colleges was there before COVID, but COVID, forced us to physically, distance. And what that does is create a lot of isolation. And so, we thought, no, the Recovery College needs to address that. So it did go to the virtual space. So even though, yes, we had that issue about, physical distancing and isolation, because we were in virtual, we could reach more people now. We could, because before when Ontario Shores, I'll speak, we were in physical classrooms in the hospital. And so maybe there were transportation barriers, but now we can reach people remotely. And what it actually forced us to do is forced us to come closer to the fidelity criteria of a recovery college and have it open for anyone. Whereas before, mostly our service users went and family members. But now, because it's virtual, anyone can go. And so Erica and her team, you guys created the platform basically on the CMHA's website, where we list every operating recovery college that has that capability. So I'm talking to, Jen Rosso, a manager at Ontario Shores, a forensic manager, who's looking for stuff for our forensic service users to do. I'm like, oh my gosh, CMHA Calgary has a course on this, So now we find our service users can access any recovery college that has the virtual platform and vice versa. So really all you need is access to the technology to do that, but each college has a slightly different interface, but because there's no referral required, anyone can just self-direct, go to the CMHA website, click on a college and register for a course. It's very low barrier, which as you know, Darryl, working in hospital settings, some of our programs have huge wait lists, right? And require referrals and all those things. So this is a very low barrier means of providing people with that connection, with that peer-based education and support, so anyone can access it.
I guess what I'm trying to say is, if I don't know anything about Recovery College,
what does it look like? How can you manage your
well,
expectations?
that in like, in terms of illnesses, like, do I, because sometimes our services are geared towards people, like especially at Ontario Shores, it's, we deal with people who are the most in need in a lot of cases, right? People who are quite ill. For
Yep.
Recovery College, it doesn't sound like I have to be at that, maybe on that
No.
side of the ledger.
No.
So if
So-
I
so-
have anxiety or schizophrenia, or if I have depression, bipolar, you name it, like, how do I know that I can access, or can I access, a Recovery College course?
Absolutely. So you can have bipolar disorder. You can have, or maybe you don't. Or maybe you don't accept your diagnosis. Anyone can and you raise an interesting point too, because a lot of times, we'll hear that person's too ill to go to Recovery College, like they can't. And I'm amazed when our clinicians say, you know what, it's not for me to decide. And I've seen people who were thought to be too ill to attend and thrive in a college. That's sort of the thing about Recovery College. In terms of impact, we know it impacts connection and hope and a positive identity and making sense and empowerment. But really, we don't prescribe. Like, everybody gets something different out of it. And even you might have the same learning objectives for a particular course or curriculum, but depending on who makes up that course, it's very discussion based, so it'll look different. And offering it one time, it'll have this awesome conversation. The next time you offer it, it's a different conversation, but equally awesome. So anyone can go. You don't have to have a diagnosis, but if you do, that's fine. And you decide if you disclose. You decide how much you share, because, everyone is an expert by experience, right? So how much of that you want to share is really up to you.
I think another piece too is that given COVID and how so many recovery colleges have moved to virtual, which does increase the accessibility of courses, because we're removing the geographic boundaries of who can attend recovery colleges, and so that actually increases the number of courses available, the type of courses available, and so you may find, CMHA Kelowna is offering courses that really speak to you, and so you could take one, because maybe there is a course around, learning to live with psychosis or learning to live with anxiety, and so there might be courses that kind of speak to people out there that previously they might not have been able to access but now can, because courses have become virtual. But there are many courses that, like Simone was saying, regardless of your mental health status, could be beneficial. And I know a lot of recovery colleges have been so responsive to COVID, knowing the toll it was taking on mental health sort of collectively. So there were a ton of courses that were developed around, conquering loneliness or living through a pandemic. And those are the kinds of courses that, again, sort of have such a wide audience. We've all kind of experienced this together, and there's challenges and anxiety-provoking things happening in the world, and so these kinds of courses are really designed for anyone and everyone, and the whole idea is to bring people together who might feel alone or might feel that they don't know where to go. And one of the core principles of Recovery College is really about making connections. So it's making connections to each other in our shared experiences. It's connecting people to other services or supports in a community through partnerships, and connecting people to the content and giving them tools, resources, tips, and all of those through the courses. And I think that, like Simone was saying, one of the one of the silver linings of living through COVID is that our programming through recovery colleges is more accessible to a lot of people because of the virtual nature of it. There's still limitations in who can and can't access virtual programming, so we're still working to make sure that the programming is accessible for everybody, and that's something moving forward we're still trying to keep at the front of mind and make sure if people don't have internet access or if they don't have computers that can do video conferencing, then making sure we're able to support that and problem solve some of that, because we do really want the recovery colleges to be open and available for anyone who feels they would benefit from it.
It's a real shift when you talk about being in Ontario and finding a course at CMHA Kelowna that you can take. And I understand the technology piece, but we've been so programmed to access the services in our area that if they're not there, they're not there. And now you're not just participants, but staff are encouraged to, I guess, solutionize different ideas based on this increased access. That's, I never would have pictured that a piece of this whole thing. Has that been a difficult mindset to shift at all, like to get people to think outside their geographic areas?
I think it's a different response depending on who you're talking to, because for those who are already in urban centers where there are multiple options for mental health supports, you might not think about going outside of your community to find that. But for more rural areas where they might not actually have any supports in their community and always have to travel outside of their community to access something like this, they probably that's already on the forefront of their mind of where are these kinds of things offered and how can I access them. So that's one of the things too that Recovery Colleges is able to sort of get at, of serving both urban people but also rural, and when geographic limitations did exist or transportation might be a problem or the timing of courses might be a problem given the distance to get to them. And so I think it does sort of create more opportunity and an openness to look beyond your community to see what else is out there. And on the flip side, with the actual recovery colleges, there's a lot of partnering and collaborating between them to say, hey, in our community, we really need a course around loneliness. And they can look to others who've already created something, and people are very willing to share those kinds of things. And so they'll take it back to their recovery college, tailor it so it's relevant to their community, to the needs that they have, but not having to start from scratch. So I think one of those pieces is that we are trying to get more content out in the different recovery colleges, keeping in mind capacity of not wanting to overburden the staff of one particular recovery college, and making sure that people in the community have access to the supports in their own community first and foremost. But
Erica,
I think, yeah.
I have a quick question, because as I'm listening to you talk, I didn't know what CMHA was like before this part. But do you think, because you were talking about, I do see the collaboration, I see the sharing, I see like what you're talking about, Darryl, too, about how you can shift the mindset and go. Do you think that this initiative has brought the branches closer together, or was that always there?
I mean, I don't know because I wasn't there, but from what I'm hearing, people know more about what's going on in other branches for sure. People are able to collaborate and share and connect with people they maybe haven't been connected with previously. And so I personally have seen a lot of really great connections being made that hadn't been established before. And that's sort of within the scope of the Recovery College mental health education type program.
And I like that, because I feel like so much service delivery is siloed, right? And the more we can share, collaborate, learn, I think the better system navigation we can offer, right? So we wanted to launch recovery colleges, and we want, but if this is the case, a wonderful sort of offshoot of that undertaking is to integrate us better as a as a country, really, too. Anyway.
Yeah, and I think from CMHA National's perspective, we really are striving to strengthen our own federation, and I think this is one of the vehicles we're able to do that, and I think we are doing that in part through this community of practice, by having dedicated time for people to come together, to give them space and a platform to share what they're doing, to ask questions, to sort of problem solve together as a group. And I think that has been a really successful process to get people engaged in talking who otherwise might not know that others are actually running that kind of programming. Because, and you can understand that, there's so much going on at each branch at a local level. So many programs that they're offering, and they are offering, direct servicing and mental health promotion. And so for them to also know what's going on in all of the other branches is, you can understand how they might not. And so this is a great way to help connect them and bring awareness of our collective efforts as a federation.
One of the things I wanted to just circle back to a bit is the content of a recovery college course. And I think when we talk about, just the nature of our organizations, and we talk about mental health treatment and helping people living with mental illness, you might think that every course is like super intense and may have like whether it's specific illnesses or symptoms or whatever the case may be that you're addressing that. But I'm not sure about CMHA's recovery college kind of course calendar, but I know at ours we've had guitar as a recovery college course. One of our colleagues did a photography recovery college course. So there seems to be a variety in different ways. I guess more, I'm not sure the word I'm looking for, but less obvious ways to connect with people, kind of various forms of content.
And what I find interesting is, even you're right. There are some heavy courses, like there's courses on bereavement and loss, which can get heavy. But you're right. There are art classes. But even though you may think art is not heavy, just as well as I do how art can save someone's life, because we've heard it. We've heard our own service users say, I was told about this art class and I didn't want to go, and I thought, no, I'm not a kid, I'm not going to draw. And then on the other side an individual realized, oh my gosh, I'm an artist, and didn't even know that lurked there, and now identifies as an artist, produces art, and says that art saved his life. So even the most, you think non-heavy sort of just to connect, there's always possibilities. That's what you never know what, and then I even hear about too, folks that go to the art class now, and this is the actual goal of the Recovery College, is that community integration. Go as a group to paint nights in restaurants, right? That's what we it's nice to be in the Recovery College, and it's nice to be at Ontario Shores, but really, what you want to do is create that opportunity for social inclusion, for community integration. So I've seen the most, you would think benign course, like it's, learning art or whatever, really transform someone's life. So you're right. It's full of possibilities. And as a researcher, it's kind of interesting because I have the stories, right? If I could publish a paper on one case study, just how it saved someone's life, that would be so amazing. But, as a researcher, we sort of look at aggregate data and things like that. But I'm sure, Erica, you've heard too, like just how transformative it can be for someone's life. Mm-hmm. I can't overstate it. I really can't.
Yeah, and I mean, I've heard stories too from the people who are developing the course content, because one of the main core principles of Recovery College is that all of the courses, all of the elements of the Recovery College are co-produced with mental health professionals and people with lived experience. And in working with the people developing the courses and going through that co-production process, I've heard the things like, I wish I had this when I was going through like my lowest times, or this is exactly what I needed when I needed it. And so hearing those kinds of things from people who are now involved, so that's also really empowering for people to be able to contribute to developing courses and delivering courses that they truly believe in, and they know the impact that it can have. And I think that in itself is really powerful within this program as well.
As we think about, the kind of the journey of getting here, getting to this, the work that Ontario Shores was doing, the work that CMHA wanted to do with the help of our hospital and I'm sure other partners as well. You think about this that you've been on. Is there one or two things that you're more or less particularly proud of? Is there anything that stands out in this time, whether it's working through the pandemic, finding creative ways to deliver care? Is there anything that stands out?
I think the hard work, like this was hard work. I'm not gonna lie. Just seeing the uptake, I don't know that there's any one particular instance. Actually, no, that's not true. I would think the last community of practice meeting we had, Erica, when Katie David presented basically this process evaluation. So it was looking at the implementation of recovery colleges across Canada. So she was looking at the fidelity criteria. Did we implement as intended? What did implementation look at like at and for me, that was a time to really pause and say, oh my God, look at all the work we did. Like, look at all of these colleges. And I think I had a wow moment. So I think if there was a moment, that was it, when we could actually sit back. Because, you have one-off meetings here and there, and you don't see the totality of the work. But that meeting, when she was able to present all of the implementation we did, and also implementing in novel contexts, not just mental health services, also at the Ability Center and in universities, for example. So that, I think, was a big moment for me personally.
I think for me, it's the fact that there are so many recovery colleges actively running now, and so many who are sort of in the beginning phases of planning, and that, like Simone had said previously, like going from really zero in 2016 to now, I think, we have over 20 that are active. We have many in the works of planning, and a lot of that, it was because of this partnership, because we were able to actually give some of these branches some resources and helping them do needs assessments, helping them understand the model, talking to them about how they take their existing programming, because so many local branches already do a lot of this really good work. They already have peers involved in the work that they do. They already do mental health education. And so helping them just sort of, transition what they already excel at into a recovery college model has been, I think, really, really great, just to see the excitement of people, to see the uptake of it, and really being able to support at that local level in getting people set up and so that they can run a successful program.
It's sometimes in kind of this industry, people come in from another organization, whether they're partners or labeled a consultant, and eyes kind of roll sometimes when those kind of words are used. But it really sounds like having Ontario Shores having done this for a bit, and then coming in and being a resource to your people, kind of relieved maybe some fear, like that would naturally comes with change.
Mm-hmm. Yeah, and I think it's I think a huge appreciation for having Ontario Shores as our guide in many aspects, and having Simone and Katie David connecting directly with our local branches and having those what is a recovery college conversation and sharing courses that have been developed at Ontario Shores has been a huge benefit to many of our branches, because then they're given a template of what they can learn from. They can implement and start small and then grow themselves once they sort of get their toes wet a little bit. And so I think what Ontario Shores has offered to all of our local branches in getting up and running is invaluable, because without that it would have been more challenging to get up and running, and it would have taken a lot longer, I think, had we not had the resources that Ontario Shores was giving us and supporting us with.
For you, Simone, having this recovery college concept in practice and being able to apply it to like a larger canvas, like a national canvas, did that have appeal to you, like personally, to be able to like kind of try it out in different parts of the country? And has it made our programs that we offer better by kind of reaching out nationally and hearing other stories?
I think yes, definitely. The appeal. So I've been doing this for 5 years, right? And I have my experience. I know what I know. I've got access to certain literature. But as it gets implemented in other places, and we start to talk to other people who have other ideas, my understanding of the Recovery College sort of phenomenon is evolving too. And I'm learning. We're looking at all kinds of applications, different applications. What does this look like? And I think that's, there is fidelity criteria for recovery colleges, but, COVID has, forced us to really be nimble and think differently. And so, I think my understanding of recovery colleges is constantly evolving. I'm learning. I have met so many great people, and there's actually been so many other offshoot collaborations because of this. So I think my program of research in general is getting stronger because it did position me sort of on a national landscape. So yes, as a researcher, yes, that's always good when you can get an audience like that to learn about what you're doing and what you're researching. So I think naturally, like-minded individuals have come forward, and I'm able to form now wonderful research collaborations to look at co-production, to look at micro-credentialing, to look at what does this look like in the university context. So, I've been very fortunate. This is, for me as a researcher, this was, a great opportunity for sure.
Yeah, and I think because there have been a few CMHA branches who've had their recovery colleges up and running for quite a few years as well. So I know, CMHA Winnipeg was, I think, one of the first CMHAs to offer it. I know CMHA Calgary has been quite established for a long time. And so we have within our own organization these champions and really great examples of recovery colleges as well. So I also think that while we've really tapped into Ontario Shores to really learn and to get that support, I also think that some of the findings and the learnings from that community context within some of those established recovery colleges within CMHAs has also given Ontario Shores some food for thought and some insight in terms of implementing within community context and different processes. And I think that's one of the beautiful things about Recovery College is that, yes, there's the fidelity criteria, but there's a lot of flexibility in how it gets operationalized that really does go and fit within each unique context and each unique community. And I think there are many CMHA branches who've done such an incredible job of that. And so we have some really great examples of our own recovery college in Canada of how that can look, and they're not all sort of a cookie cutter approach, but they are unique. They do respond to their own community, and I think that is part of what makes it so successful.
I know if somebody wants to access Recovery College on Ontario Shores, they can visit our website, ontarioshores.ca. Our social media channels have often promoted registration dates and different courses. At CMHA, where does somebody go if they want to see what's available on a national level in terms of Recovery College?
Yeah, so we have a website within our cmha.ca page, and so people can go to our Recovery College page, and there's a list of all of the recovery colleges that have a website listed, and then there's also the active courses listed as well for each of the recovery colleges. So if someone's interested in just looking to see what kind of courses are out there, they can definitely go to our website and just kind of look through there. And if they're interested, then they'll be directed to the right recovery college and the right course for them to register online.
Great. Well, thank you. We managed to get through that without children busting through Simone's door or contractors in front of your camera.
They did come down the stairs.
Well, thank you very much, both of you. It was a great conversation, and thank you for all you're doing in the kind of recovery realm.
Thanks for having me.
Begins